Hi, how are you?
Good, how are you?
Very good. So I see you're a new patient with me today. Welcome to the clinic.
Thank you.
I'm Dr. K. First, let's just verify your first and last name and date of birth.
Yeah, my name is Relove.
Okay.
And then my birthday is August 13th.
Okay.
2002.
Okay, perfect. All right. And then tell me a little bit more about what brings you in today.
Yeah, I'm just having some issues, like a lot of head pain and like headaches, and my face has been kind of tingly, and then some of my parts of my body have been kind of numb. So
Numbness and tingling.
Yeah.
So just the face is tingling.
Yeah.
And the whole body is having spells of numbness.
Yeah.
Okay. How long has this been going on?
I'd say probably like 3 weeks.
Okay. And has the head pain been around the same time that started?
Yeah.
Okay. First, let's start with the headaches. Are they like a throbbing pain, or is it a very sharp pain? Is it dull? Go ahead and describe that for me.
I'd say it's kind of like a sharp pain for a little bit, and then like kind of a duller pain. Like sharp pain for like a minute or two, and then dull for about 30 minutes.
Okay, it's probably more of a sharp pain then that hits you so suddenly that it reverberates. Okay, I'm just going to make note of that. And then, what parts of the body would you say are numb?
No, I think it kind of like switches around. So
Okay.
sometimes my feet, sometimes my arms.
So it's the limbs of the body that you're having those numbness on.
Yeah.
Is it like the fingers and toes, or the whole hand and feet?
It starts with fingers and toes, and then it's hands and feet.
Okay, all right. Okay, since this is my first time seeing you, I'm just going to ask you a few questions about your family history. So I'm going to name a few conditions and let me know if that's in any of your immediate family. Mother, brother, sister, father, even grandparents. All right, so hypertension?
No.
No. Blood disorders?
No.
Lung disorders?
No.
Okay. Neurological problems?
Oh, my grandpa.
Okay. Okay. Any problems with vertigo in the family?
No.
Diabetes?
No.
Okay. Thyroid issues?
Yeah, my mom has some thyroid issues.
Okay. Okay. Pelvic disorders? No. Okay. All right. So you said you're having some issues with the hands and feet. I'm going to take your vitals in a second, but for now, just want to see just the sand right now. Okay. Sorry, my hand's a little bit cold as I touch it. So right now, as I'm holding it, do you feel both of my hands holding your fingers? Okay. Go ahead and spread out your hands all the way. I want you to make them into a fist. Spread them out. Do that 5 times in a row as fast as you can. Okay. Was that the fastest you could go?
I probably could go faster.
Okay, go ahead and try that for me. That's okay. Good, okay. So I'm just going to gently press against each of your fingers, and I want you to press upward to resist my push, okay? We're going upward first. Good. Okay, good. Okay, that one was a little weaker. Good. Okay, so a little bit of atrophy there. Go ahead and put them to center. I want you to try to press down against my finger. Okay. Okay. Go ahead ahead, let me see this one. Do the same thing with the fist and open. Okay. All right. Press up. Press up. Up. Okay. And press down. 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 And down. Okay. Go ahead and try to grasp my hand right here and try to pull against me. Pull the opposite way. Okay, good. Let's do the other hand. Okay, so definitely some weakness there in the phalanges. Definitely going to look into that. I'm going to start with your vitals right now, okay? Any dizziness on standing?
A little bit sometimes, just in the morning usually.
Okay. And go ahead and listen to your heart and your lungs. Okay. Sitting on the bell side for murmurs. Everything sounds good so far. Okay, no murmurs. Only S1 and S2 are present. Listen to your blood pressure. I'm going to use this arm. Okay. Okay. Make sure your legs are uncrossed. Okay, that's 120 over 80. I'm going to go ahead and slide this off. Great. Any signs of fever?
No.
Feeling hot? 97.2, perfect. Okay, I'm going to go ahead and look at your index finger. Okay, just rest that there. Okay, your heart rate is 71 beats per minute. Oxygenation is 98% at room air. So next I'm just going to go ahead and do a face examination. I'm going to be percussing, palpating, and just doing some myotones. Okay. So I'm just going to start by palpating your face, okay? Okay. Just feeling your sinus cavities for any lumps or bumps.
for edema. Go and lift your head gently. I'm just going to feel for any kind of concussion in the back. Okay, go ahead, relax. Okay, you're going to feel the cervical spine. Okay, no signs of scoliosis or abnormal curvatures. Okay, so I'm going to do some facial myotones. Go ahead and try to lift your eyebrows. Okay, lift your eyebrows. Good, now lift them all the way. Try to lower them. Very good. I want you to gently resist my push and turn your face to your left. 3, 2, 1. All right, other way. 3, 2, 1. Same thing. And to your right. Good, strong reflexes there. Go ahead and try to lift your head above you. Good. Now try to touch your chin to your chest. Okay, very good. Okay. I'm going to pull gently on your ears. Let me know if you feel pain. No or yes?
No.
Good. And let me know if I'm pulling backward, upward, or down.
Backward.
Good.
Upward.
Good.
Down.
Beautiful. Just going to do some percussions to check for edema. Okay. Going to take some measurements of the face, okay? So just keep relaxing. I'm just going to check for symmetry. Make sure there's no neurological problems. 19. 19 on the other side. Okay. 21 centimeters. Center. Okay, we have 22. Let's measure with the other side. That's 8. Okay, that's 8.5 here. Okay, still in the round. Let's go ahead and measure your eyebrows. Okay, this time. There's here. Yes. 17.
Okay. Okay. Let me go ahead and grab a seat. We're going to do some sensory tests too, okay?
Okay.
Right. We're going to start with a wet or dry test on your face.
Okay.
So, one of these cotton rounds is going to be quite wet. The other one is going to be mighty dry. Okay. So, depending on which one you feel, go ahead and say wet or dry, okay?
Okay. Dry. Wet. Dry. Wet. Dry. Dry. Wet. Wet. Dry. Dry. Wet. Wet. Dry. Wet. Dry. Dry. Wet. Dry. Wet. Dry. Wet. Dry.
Okay. So definitely a lot of inconsistencies there. Some numbness in the face is definitely apparent. Just making a note of that. Okay. Okay, the next test we're going to do is sharp or dull. Okay, so I'll do a sample test on your shoulder. This is a sharp sensation. This is dull. Go ahead and say which one you feel, okay?
Okay. Sharp. Dull. 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 Sharp. Dull. 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 Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay. So some inconsistencies there, definitely. Okay, so now we're gonna do the difference between, actually let's do paper or plastic. So when you feel this, you're gonna say crinkle. When you feel this, you'll say paper.
Okay.
Okay, it's a little bit more advanced here, but I have faith in you, okay?
crinkle, paper, crinkle, crinkle, paper.
Good.
Crinkle,
Good.
crinkle, 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 paper, 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 crinkle, crinkle, paper, 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 crinkle, crinkle, paper.
Okay. Good. You got a lot of those right. So that's good. One more sensory test, and then we'll move on to the other tests. Okay. We're going to do a pressure point test. So you're going to feel either 1 or 2 pressure points on your skin at the same time. If you feel 1, say 1. If you feel 2, say 2. Okay?
Okay.
All right.
1, 2, 1, 2, 2, 2, 2, 2, 1, 1, 2, 2, 2, 2.
Good.
1,
Good.
1, 2,
Good.
2,
Okay.
2, 1,
Good.
2,
Good.
2, 1, 1.
Okay. So some inconsistencies there. A little bit concerning. Okay. Just gonna go ahead and check the skin of your face. You can keep your eyes closed. Very well perfused. Don't see any purpling. Outward signs of nerve damage not present. Okay. We're going to begin the eye exam. So go ahead and open your eyes and follow this light. Just your eyeballs. Good. Okay. Now I want you to let me know when my fingers enter your field of vision. So when they do, say no. Go ahead and pick a point on that wall. Say that furnace thing. And let me know when my fingers enter your field of vision.
Now,
Okay.
now, now, now.
Okay. Now let me know when they leave your field of vision, okay?
Now,
Okay.
now, now.
Okay, very good. Go ahead and look at me. How many fingers am I holding up?
2,
Okay, try to look right at my nose. And let me know how many.
2, 1, 3, 3, 3, 1, 1, 1, 2, 2.
Very good. I saw you tried to cheat there. I'm going to look in your eyes now. Okay, so go ahead and look straight ahead. Sorry about the bright light. Very good. Pupils round, reactive. No yellowing of the eyes. Look to your right, your left. Up, down. Blink once. Okay. Do you have any dryness in your eyes or any eye problems?
Sometimes, yeah.
Okay.
My allergies act up.
I have a couple eye drops to recommend for you for that. One is Random Refresh, but I'll send you all the information. I'll write it down for you at the end of this.
Okay, thank you.
Because I have the same kind of problem. And,
Yeah.
Go and look straight ahead. Okay, good. Look to your left, right, up, down. Okay, blink once. All right, very good.
Okay.
All right, I'm going to hold this chart for you right here. Can you read that third row beginning with the F?
FPH.
Good. What about the row beneath it?
OLCF.
Good. The row beneath that one beginning with the S, ending with the D.
SBJHD.
Good. And beneath that, go ahead and read that normally.
EPTZO.
Okay, what about the row beneath it?
CFOHJ.
Good. And that last row?
LTFPH.
Good. And what's this color right here?
Green.
And right here?
Red.
And which circle is bigger, number 9 or number 6?
9.
Number 8 or number 4?
8.
Number 4 or number 2?
4.
Okay, good. So, no concerns there. Next, I'm going to take a look inside your ears, okay?
Okay.
Go ahead and turn your head this way. Turn your head, good. Okay. Some mild wax buildup. Otherwise, the ear canal looks healthy. Tympanic membrane is gray, invisible. No signs of redness, scarring, or irritation. How is your hearing, would you say, for the most part? Pretty good.
Yeah.
Okay, go ahead and turn your head this way towards me and I'll look. Alright, same here. Some definite wax, but the membrane looks very intact. Okay, no issues here. I'm just going to look outside on the outer edges of the auricle. Looks good to me. Go ahead and turn facing front. Just looking here. Everything looks pretty clean here. Alright, great. Okay, go ahead and face upwards. Go ahead and let me know how many snips you hear. 1, 2, or 3.
1. 2. 3. 3. 1. 2.
Okay. Which snip sounds further away? Snip 1 or snip 2? Here's snip 1. Here's snip 2.
Snip 1.
Okay. Which snip sounds further away? Snip 1 or snip 2? Snip 1. Snip 2.
Snip 1.
Good. Okay. Okay, I'm going to place this tuning fork on your head. When you hear and feel the sound, well, you're going to hear and feel the sound, but when it stops, go ahead and say now, okay? Okay.
Now.
Good.
Now. Now. Now.
One more, just using a different tuning fork.
Now. 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 Now.
Good. All right, I'm going to whisper some things in your ear. Let me know what you hear. Repeat exactly what you hear after me. Christmas.
Christmas.
New Year.
New Year.
Valentine.
Valentine.
Shih Tzu.
Shih Tzu.
Puppy dog.
Puppy dog.
Snowman.
Snowman.
Good. Okay, I'm going to give you some things to smell.
Okay.
So this is a very advanced smell test. Some of these are very specific essential oils. So I'm not expecting you to get them completely right, but go ahead and let me know if, do your very best. Okay. What's this smell like to you?
Lavender.
Okay, that's good. It was chamomile. Go ahead and inhale. What does that smell like to you?
Grapefruit.
Cinnamon. It's not good. Not good so far. Go ahead and inhale.
Eucalyptus.
That was lavender. So that was very close. Okay. Go ahead and inhale.
Is that orange?
It's bergamot. Go ahead and inhale. What does that smell like to you?
Peppermint.
Okay, that was rosemary. Go ahead and inhale.
I'm not sure.
That's okay. It's a rose. Okay, just a couple more and you'll be finished. Okay, go ahead and inhale.
Nutmeg.
Grapefruit. Okay, and last one. Go ahead and inhale.
Vanilla.
Very good. You got the last one perfectly right. The others not so much. So okay, we're gonna do a taste test. I'm just gonna put a strip of paper on your mouth. I'm gonna taste it. I'm going to remove the strip. Let me know what it tastes like. So go ahead, open, close, taste, open. What does that taste like to you?
Green beans.
Green beans, that was correct. Green beans was right. This next one, go ahead and open, close, open. What does that taste like to you?
Mushrooms.
Yes, that was mushrooms. Perfect. Okay, so I'm not worried about that. Okay. Okay. So, I'm going to do a quick look at your scalp before we move on to your feet, okay?
Okay.
here. Okay. Hair looks pretty healthy so far. Okay, I don't see a few dandruff flakes, no lice, no itching, no signs of red or flaking. Okay. Now do you feel this when I tap here?
Mm-hmm.
Okay. Do you feel this here?
Yes.
Okay. We're going to do sharp or paper, okay?
Okay. Sharp. Paper. 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 Sharp. 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 Paper. Sharp. Paper. 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 Sharp. 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 Paper.
Good.
Sharp.
Good.
Paper. Sharp.
Good.
Paper.
Good.
Paper. Paper. Sharp.
Good.
Paper. Sharp.
Good.
Paper. Sharp. Paper. Sharp. Paper.
Excellent. Okay. I take a sample of the scalp. Two. I did notice some dryness. I'm going to just apply some foaming solution just to that part. Just exfoliating that in. that rest there. Next, I'm just going to go ahead and look at your legs and feet, okay?
Okay.
Okay, Rhiannon, I'm just going to be palpating your legs, okay? Just going to be feeling. Okay. All right, go ahead and here. All right, so we're gonna do the same tuning fork thing with just your legs, okay?
Okay.
So let me know when the sensation stops.
Okay. No.
Okay?
No. 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 No.
Okay. Do you mind if I just lift your jeans into your ankles? Okay. Okay. Just feeling for any edema in the feet. Thank you. Okay. I'm going to do a Babinski response test. I just want to see if your feet have a neurological response to my push. Okay. Okay. And let me know how many times you feel the squeeze on your toes. Once, twice, or 3 times.
Okay. Once. Twice. Once. 3 times.
Okay, Rhiannon. So after your exam, you are having some issues neurologically that I suspect. I just want to take precaution. So I'm going to send you in for some scans where you're going to get an MRI, CT scan, and an X-ray just to make sure that you're doing okay. Your vitals are all great. So I think that this is probably just a minor issue, but it's something that we want to be on top of, okay?
Okay.
All right, so I'll get you all set up with that in the front. Thanks for coming in today and being a wonderful patient.
No problem. Thanks for your help.